Hey everybody, how are you doing? This is Stephen Fogg with Fogg Healthcare Marketing. Just want to touch base with you guys again today and see how things are going. Um, First and foremost, we'll talk telehealth. You know, as I mentioned yesterday, a lot of practices are going to. That was their answer to everything going on with COVID-19 was to institute some form of telehealth, either on Zoom, like I'm using right now, to record this conversation, or Skype, or you might have a EMR or HIPAA compliance solution through a larger EMR service. But I'm curious about this. So, I'll be honest, I've been a kind of proponent of telehealth for some time now. I think it is the future, especially with costs going up. It's a way to reduce costs, keep doctors more remote, makes them more flexible, and be overall good for the ecosystem of our healthcare system. But as I think about it too, I was thinking about what is this going to look like? With us developing now that government agencies have relaxed laws enough to make it efficient for smaller facilities and practices to develop the infrastructure for telehealth. What does that look like, and what's it going to look towards the experience as a patient? I always talk about in the healthcare space about providing empathy, being educational, being resourceful. It comes in the healthcare space because it's a different beast than, say, you're trying to communicate a message around a new car or a brand new gadget that's going out. We're definitely in the healthcare space. It's a very emotional. Multiple times it's life or death, especially right now, COVID-19. There's a lot of uncertainty out there and a lot of life and death questions. So thinking about that makes you wonder about the long-term side effects of telehealth. I think, again, I stress on how I believe this is a good tool to be used, but I think it also can be taking something out of the play, which is that personal relationship we have with our providers. Now, I know as a cancer survivor, I have very personal relationships with multiple providers out there, from my general practitioner to my oncologist, and everybody in between. I know them on a very personal basis. When I see them, we do as family along those lines. That's the relationship I've grown and developed with my practice. I'm curious, with instituting telehealth long term, is this going to affect the patient-provider relationship? I believe it's going to. To what extent, I still don't know. And I don't know if it's necessarily going to be a bad thing to be less personable with your provider. Maybe to make it more of a machine that needs to be. I mean, you think about that. Maybe that's where a lot of the cost comes into healthcare right now. We have a healthcare machine built right now, especially in a systems-based approach, where providers are seeing patients every 7 to 8 minutes, but they're still needed to provide a personable experience. I think we've all kind of grown accustomed to that. So what if we try to remove the personal side of things and just kind of focus on the machine side? It's a question that I think we're going to be needing to find and understand as telehealth gets closer and closer towards being a full, streamlined reality into our everyday existence, not just in a pandemic or a problem that we're facing with on a short-term basis. So I just wanted to come and address those questions. Again, as somebody who's really into providing empathy and education, being resourceful in healthcare, as we move closer and closer towards inevitable long-term use of telehealth, what does that do in the personal relationship we have with the provider and the patient? That's a question I'd love to hear some feedback from you and your providers. So that's what I have for today. I hope you're all staying safe out there. All you frontline providers and healthcare staff, you're in my thoughts and prayers. Please stay safe out there. And if there's anything that I can do from afar, I will do it. Thank you. Have a wonderful day. Bye-bye.